Hello, my presentation is on Gerd, and yes, so let's get started. Gerd stands for esophageal reflux disease, and it's a chronic condition where the stomach contents flows back into the esophagus, which is mainly due to damage or a weak lower esophageal sphincter. Gerd is sometimes referred to as acid reflux as well. The lower esophageal sphincter is not staying closed, so that is the cause of the acid to backflow from the stomach to the esophagus. This allows backwash of stomach contents and acid into the esophagus. The esophagus is a tube that connects the stomach to allow food to enter into the stomach. It squeezes food down into the stomach each time we swallow, and the lower esophageal sphincter opens. It plays a role in GERD if the esophagus is unable to perform this role correctly due to impaired mobility. This leads to major irritation of the esophagus. How does this happen? Weak pressure due to delayed gastric emptying, hiatal hernias, pregnancy, obesities, or overeating, or some medications like histamines, calcium channel blockers, antidepressants, sedatives, and smoking can cause this as well. Here on the slide, there's a picture of a hiatal hernia, and you can kind of tell, like, with that hernia there, that sphincter's not being able to close correctly. And hiatal hernias are caused from when the stomach pushes through a weak part of the diaphragm and sits on top of it. And it allows pooling of the stomach acid in that area, and then that pooling can go back into the esophagus. Let's see. The esophageal mucosal lining erodes and becomes damaged over time from the constant backwash of the acids. The stomach acid also erodes the esophagus. If the acid and contents make it past the upper esophageal sphincter, it can enter into the lungs, causing pneumonia, aggravating asthma. You'll have signs and symptoms of cough, ear infections, voice changes, and nighttime coughing is a big sign with acid reflux. I should say a big indicator. Some clinical manifestations are going to be here on your left in the blue box. You'll also have, some of the signs and symptoms you'll have is gastric pain in the upper part of your stomach, regurgitation of food. They'll have a bitter taste in the back of their throat, regular occurring burning sensation in the chest or abdomen. This can also feel like the person's having a heart attack. And this pain can radiate to the neck, jaw, or back. So you want to make sure that you're checking the symptoms closely and making sure that you differentiate between a heart attack and GERD. They'll also have some lung problems due to that acid reflux, and problems swallowing as well. Some subjective and objective. You want to identify the symptoms related to GERD, differentiate from signs of a heart attack. You're going to assess the signs and symptoms rather than just the heartburn. Do they have respiratory symptoms? A dry cough that's worse when laying down. Hoarseness of the voice. Is the pain aggravated when they eat a heavy meal? Do certain foods make it worse? You're going to help them develop a diet plan to decrease these symptoms. And you're also going to check for signs and symptoms of aspiration. Some diagnostic tests used is endoscopy. This is used to see the changes of the esophagus. The esophageal manometry is used to look at the function of the esophagus, so that sphincter opening and closing. The pH monitoring is used to measure the amount of acid in the esophagus in a 24-hour period. So here's a picture of that. I thought that was pretty interesting. They'll stick a catheter down the nose into the esophagus, and this device will measure your acid level, and it can test to see if you have acid reflux. So that little probe there will go down and it'll measure the amount of acid, and that will tell the doctor how much of your esophagus is being affected by that acid. Some surgical treatments, I'm probably going to butcher these names. The Nessin is used. It involves wrapping a layer of the upper stomach wall around the sphincter to lessen the possibility of acid reflux. And then that top picture, that's kind of what it looks like. And then the Sophy X folds the tissue at the base of the stomach, acting like a sphincter. The Stretta uses electrodes to create scar tissue to strengthen the esophagus. So they'll go in and burn down the sides of the esophagus, kind of to strengthen that wall, to help that sphincter open and close. And then the Lynx uses a titanium band with magnetic cores when implanted around the lower esophageal sphincter, which strengthens it by closing the sphincter when needed. So as you can see in those pictures, that band is around the lower esophageal sphincter, and when the food passes, it allows it to open, and then when it goes through, it closes back up, not allowing that backwash back up to the esophagus. Some medical management will be antacids, so that's going to be like your Tums. Histamine receptor blockers, they block histamine. When histamine is released, it causes the peritoneal cells to release HCl, but this response will be blocked, so gastric acid secretion will be decreased. So it's just helping decrease that gastric acid. Another one is proton pump inhibitors. These attach to the proton pump on the peritoneal cells, which is the hydrogen and potassium ATPase enzyme, and blocks the release of hydrogen ions. These ions would mix with the chloride ions from the gastric acid, but this is blocked, so there's a decrease in gastric acid due to that whole process. And then the prokinetics prevent delaying gastric emptying by improving pressure in the lower esophageal sphincter and the peristalsis of the GI tract. Some nursing interventions and patient teachings that you're going to want to do. You want to teach your patients to eat small meals. You want them to avoid foods that are greasy, fatty. They're also going to want to avoid alcohol. That's just going to irritate that esophagus lining. You want to avoid eating right before bed because remember, laying down just gives that stomach acid an easy pathway of coming back up. You want to sit up after you eat. This is just making sure everything digests right. And you want to teach your patients to try to reduce or avoid their caffeine intake, and also stop smoking. Another thing that I thought was interesting was non-fat milk can help with the relief of heartburn, but it has to be non-fat. The fat in milk actually aggravates acid reflux. The prognosis for this, if not controlled, it can lead to life-threatening problems. One of those problems are Barrett's esophagus, which is a gradual or repeated scarring that can permanently damage the esophageal tissue and produce strictures. This puts the patient at a higher risk of esophageal cancer. Other than that, with treatment, medication, it's a good outcome for the patient to recover. And that's all I have for you. Thank you so much. Bye.